to discuss about cerebellar lesions. In last class, I discussed about anatomical division, functional division of cerebellum, and about the cerebellar circuit. So today I will be continuing on that, mainly applied aspects. So lesions of cerebellum will cause what, and also about cerebellar function test. So in general, the function of cerebellum is coordination of movement. So it coordinates with the cerebral cortex, all those things we saw in last class. So main thing, if you ask in a single word, what is the lesion of cerebellum causes? In general, it is ataxia. Note it down, it's especially motor ataxia. So the movements are not coordinated. So in cerebellar lesion, one of the main thing which we see is motor ataxia. Ataxia means, A means absent. Taxi is a type of vehicle movement. So taxi means movement. So absence of movements or irregular coordination of movements. So there is incoordination of movements. Under ataxia, it's not only just movements, it is related with rate of movements, range of movements, force of movements, and direction of movements. Cerebellum is associated with not just the coordination of movements. The coordination of movements, which involves the rate of movements, at what rate the movement should be, the range, at what range, direction of the movement, force of movement. So I again tell the importance of cerebellum with a simple example like picking up a cup of tea. I will just show you. So imagine this is a cup of tea which I am holding here. Last video itself we saw it, but since it is applied aspect, it is worth mentioning. So what my cerebellum does, it will give signals to the cerebral cortex about my initial position. My cerebellum will tell the cerebral cortex that the hand which is going to pick the cup of tea is at 1 meter distance. So the cerebral cortex will calculate, okay, his arm is 1 meter distance. Then the cerebral cortex will plan for the movements like this. So 1 arm distance I will move and pick the cup of tea. Now imagine my hand is here. Now is it possible the same movement, 1 arm distance, like 1 meter distance? Example I am telling. So what will cerebellum do now? Yeah, cerebellum will tell that my hand is behind the head to the cerebral cortex. Now cerebral cortex knew the position of my hand, which is going to pick the cup of tea. So what will cerebral cortex do? Now it will change the direction of movement. What it will do? The cerebral cortex will order to bring my hand from behind the head to front, then to go and then pick the cup of tea. So whatever this was, the cerebellum main aim is sending the initial position of your body, whether it is hand, leg, whatever it is. So your initial position will be sent to the cerebral cortex, and cerebral cortex will act accordingly. For one more example, imagine I am keeping my hand here, but the cup of tea is at the same position. Cerebellum is not bothered about where the cup of tea is. Cerebellum is bothered about where your initial position of body is. Cerebellum is bothered about your position of the body, your coordination, your proprioception. So imagine the cup of tea is here, my hand is behind. So now what cerebellum will tell to the cerebral cortex? Cerebellum will tell that the hand which you are planning to pick the cup of tea is behind. So what cerebral cortex will do? Oh, it is behind. Okay, I have to bring the hand in front of the abdomen. Then I have to go 1 meter distance. Now imagine if cerebellum I am keeping here. If cerebellum is not coordinating properly, the cerebral cortex will not exactly know my initial position of the arm. So as stored in last class, I may struggle to pick the cup of tea, or my intention tremor will be there. That is, my intention is to pick the cup of tea, but I will not be able to. So that's why it is motor ataxia. So the movements are affected. I will just write dysmetria is diadokinesia, asynergia, nystagmus, intention tremor, just now you saw. Don't worry, I will explain one by one. Slurred speech, which comes already in dysmetria, hypotonia, past pointing, even called as overshooting, then rebound phenomena, then drunken gait, then decomposition. All these are features of cerebellar lesion, and there is a mnemonic. We call it as Danish. You can note it down. Danish. So D for you can use all. Dysmetria, dysarthria, dysdiadokinesia, Drunken gait also you can use for decomposition of movements. And A for asynergia, N for nystagmus, I for intention tremor, S for slurred speech, H for hypotonia, D for all the dis. A for ataxia best. A for ataxia. So you remember Danish, it becomes very easy. The cerebellar lesions. What is dysmetria? Dysmetria is nothing but meter, the movements. So dysmetria is nothing but the same thing what I discussed. So there will be incoordination in rate, range, force and direction of movements. Similar to ataxia. So that is dysmetria. Dysarthria. Arthria is associated with speech. So there will be slurred speech. That's why we use for S. So even dysarthria is equal to slurred speech. But Danish, for remembering we are saying. So slurred speech. So for speech, vocal cords, the muscles of speech are involved. So there also coordination will be missing. So as I told, there is motor ataxia. So speech is also a type of motor movement and that speech is also affected. So there is slurred speech or scanning speech. Then dysdiadokinesia. Kinetic means movement. AD means alternate movements. So dis means not able to do. So I again repeat, dysdiadokinesia. So alternate movements they will not be able to do properly. For example, here this is prone position, this is supine position. So I am able to do alternate prone and supine positions very fast. For example, I am not missing it. The reason is, as I mentioned, the coordination is normal. My cerebellum is functioning normally. My spinocerebellum is normal. My coordination is normal. Having cerebellar lesion, what will happen? Prone, supine, I will get confused. So I will not be able to do correctly. This is called dysdiadokinesia. Not able to do alternate movements fastly and correctly. The nystagmus, very, very important. So nystagmus is also associated with vestibulocerebellum. So I already told in last video, vestibulocerebellum is the input coming from vestibular apparatus to the cerebellum and it is concerned with balance and equilibrium. So nystagmus, for even visual, what happens if the vestibular cerebellum is not functioning normally? When I gaze at the object, there will be movement of eyeballs. The eyeball, there can be horizontal nystagmus or vertical motion. The movement of the eyeballs, that is called nystagmus. In cerebellar lesion, nystagmus is usually seen. Intention tremor already we discussed. At rest, when I am not trying to do any movement, no problem. But when I am trying to pick the cup of tea, there is an intentional tremor. So I vanish. So N for nystagmus, I for intention tremor, S for slurred speech. And last video itself I told there is decrease in tone in cerebellar lesion. Hypotonia is seen. Yeah, then coming to past pointing. We also call it as overshooting. In cerebellar function test, there is a test called finger nose test. So what I will do? So this is my finger, this is nose. I am able to do correctly. That is, my finger is correctly pointing. So what test? I will ask them. If I am suspecting someone with cerebellar lesion, I will do this test, finger nose test. So I will ask him to do like this. So imagine I am the patient suspected to have cerebellar lesion, but I am having normal cerebellum. So what? Even with closed eyes, I will be able to do, because cerebellum is bothered about only my body, which I know. Yeah, I am able to exactly touch the tip of the nose. I can do on both sides because we have cerebellum on both sides. Now imagine I am having cerebellar lesion. So when I am doing finger nose test, what will happen? Yeah, the cerebellum is not giving proper information to the cerebral cortex where the tip of the nose is exactly. So cerebral cortex knows that I have to go and touch the tip of the nose, but the initial position is not clear. For example, if I am keeping here, then also I can do. If I am keeping here, then also I can do, because cerebellum is giving information that my initial position of the hand, whether my hand is here or here, even here I can do. So in case of cerebellar lesion, what happens? Yeah, this is past pointing. My finger is to point the nose, but past. Past means it has crossed, or overshooting. That's what I have written. Past pointing or overshooting. So if I am having cerebellar lesion, when I do finger nose test, there is possibility that, imagine I am normal. Yeah, I am doing correctly finger nose test. If I am having cerebellar lesion, I will not be able to point the finger correctly to the tip of the nose. It is moving beyond the nose because of cerebellar lesion. That is called overshooting or past pointing. So that is also one of the features of cerebellar lesion. And rebound phenomenon, in last class itself we discussed. So when I am doing some movement, we note it down. Cerebellum also predicts the future of your position. Your position, not the target. Yeah, imagine the opponent is keeping my hand tight and I am also giving the resistance. When I suddenly withdraw the hand, this is expected to hit my face. But I don't do that. My hand suddenly stops without my knowledge. When my hand goes to hit my face, it does not hit the face because cerebellum sends the information to cerebral cortex that the future. See, cerebral cortex, his hand is going to hit the face. Take action. So there is sudden break. Note that word. So cerebellum also helps the cerebral cortex to put sudden break on the movements. Very, very important. So that's where the rebound phenomenon occurs. If the cerebellar lesion is there will be rebound phenomenon. That is, see here, this is not expected. But if the cerebellum is lesion, when I withdraw the hand or when the opponent withdraws the hand suddenly, it may hit the face. There is even possibility that injury can occur. Drunken gait, as expected. One of the tests of cerebral function tests, you can see here, asked to walk in a straight line. I like temple, how they walk. Like that you can keep. So I will be able to walk in the straight line. But if I am having cerebellar lesion, so that like this, there is a possibility that I will have gait, abdominal gait. Since it is similar to the people who drank alcohol and under the influence of alcohol, we kept the name as drunken gait. So there also you can use this D. So drunken gait. And finally, decomposition of movements. That also D. One D you can add. Decomposition of movements is nothing but when your cerebellum is normal, you can use all joint movements at the same time. But when cerebellar lesion, it is very difficult to use all joints movements at the same time. For example, flexion, extension. So all the joint movements acting at a single time is very, very difficult. That's called decomposition. So the composition is not activated. It is decomposed, like decomposition of joint movements. That is also one of the important aspect of cerebellar lesion. Please note it down, very important. If there is a term called motor ataxia, obviously there is one more term called sensory ataxia. So next question. So where is sensory ataxia seen? So motor ataxia, the movements, motor ataxia is seen in cerebellar lesion. Sensory ataxia, that is, there is a defect in proprioception, one of the sensation. So my position sense I am not able to recognize with eyes closed, for example. So where you get sensory ataxia is usually in lesion of dorsal column. As the name suggests, sensory. So there is a defect in sensation of position sense or proprioception. So that is dorsal column lesion. Dorsal is sensory ataxia. So cerebellar lesion causes motor ataxia, not sensory ataxia. Remember that. In next class, I will tell in detail how to differentiate sensory ataxia and motor ataxia. Now coming to cerebellar function test. There are some tests to check that your cerebellum is functioning normally or not. We can divide it into upper limb, lower limb. So in upper limb, what you will do is, I already discussed finger nose test. So I will be doing on both hands. Simple. So ask to touch his nose with his own finger. Since his cerebellum is normal, you will be able to do. If his cerebellum is not normal, you will not be able to touch, and there is a possibility of past pointing, or you will not be able to touch the tip of the nose with your finger. That is finger nose test. Next, draw a circle. So I am testing upper limb. So I will draw the circle with my hand. You can see here. So I am able to draw the circle because there is the coordination and I am knowing how to draw the circle. If my cerebellum is affected, intention tremor may be there because my intention is draw the circle, but there is a tremor. So I will not be able to draw the circle properly. Very important test. Coming to lower limb, there is a test called heel knee test. Heel knee test is nothing but imagine this is my lower limb and this is the knee of the other limb. So this is the lower limb, this is knee. So what I will do? So I will be able to do. So same thing, heel knee test. Just use your other lower limb and scratch from the knee of the other leg. And you will have to scratch it straightly. That is very important. In case if I am having cerebellar lesion, when I use my heel over the other knee and scratch, I will not be able to do it correctly. So my leg will go in zigzag manner. That is heel knee test. That is done in lower limb, and again I can draw a circle. Also, but here I will be drawing my circle with my leg. So like this. So I will be drawing the circle, the same phenomenon. And in cerebellar function test, we can check the tone also, because I have mentioned Danish hypotonia. So the tone will be decreased. So I have to check the tone. So when I flex and extend, I just feel the tension of the muscles. When I flex, you can see the lengthening of triceps muscle. When I extend, I can see the lengthening of biceps muscle. This is how you check the tone of the muscle. In cerebellar lesion, there is hypotonia. Then obviously one more test, check for tone, then check for gait. So ask him to walk in a straight line. You should be able to walk. If he is having some type of drunken gait, then you have to suspect cerebellar lesion. And one more test, knee jerk. In cerebellar lesion, there is a pendular knee jerk. So motor ataxia is seen in cerebellar lesion. Sensory ataxia is seen in lesion of dorsal column or defect in proprioception. Some conditions like Gait types dorsalis. So there will be sensory ataxia. In next class, I will discuss about Romberg's test, which differentiates the sensory ataxia and motor ataxia. Thank you. We will meet in next class.